Welcome to this edition of Health Talk. My name's Julianne Raftery, and today I'm joined by Dr. Dave Mazzola, and today he's going to be talking about turf toe. So what is turf toe?
Turf toe, very common injury we're starting to see, actually a little bit less of now since there's been changes to athletic fields. Turf toe is basically repetitive hyperextension injury to the first metatarsal joint in the toe. Typically you see a lot of this back in the days with AstroTurf football players, basketball players, just repetitive hyperextension of the toe. What you can actually do is you can actually start to sprain the ligaments underneath that joint capsule of the toe, become quite painful, can actually be debilitating enough to actually take you off the court.
Is it mostly seen in athletes, or is this?
You can be athletes, yes. Mainly
Okay.
you'll see basketball, football. You will see it sometimes even repetitive runners because there's a lot of shoe wear potential problems, things like that, that could be contributing to the injury itself.
Okay. Would you say shoe wear is a cause of it?
Shoe wear is potentially a cause of it. A lot of it is the repetitive nature of constantly toeing off and putting your toe into a hyperextension state.
Okay.
Now, there's different severities. You can have grade 1 all the way to grade 3. Grade 1 being more mild, typically the stuff that we would be treating for you here. Grade 3 being there's actually significant tears to that area where you're looking at a lot of immobilization or surgery to repair.
And then how do you treat it?
So typically on our end, what we would like to do is your typical Price or Rice model, where you're looking at pressure, rest, ice, compression, elevation. It's a very inflamed injury to that foot. It can change up your gait, things like that. So what you're trying to do is you want to get weight off of that foot.
Okay.
This is where somewhere the footwear can kind of help. You can get a little bit more harder sole to the shoe. Sometimes even you'll see athletes, they'll actually put even a metal plate into the shoe to keep that toe from hyperextending. But what you're going to do is you're basically trying to reduce inflammation. So you can do local NSAIDs, if you're able to do that. Icing is a very nice, easy way to reduce inflammation. You're looking at about 20, 25 minutes. On top of that, where we can kind of come into play is more of the active care. So we're looking at mobilization of the big toe, right? We can start looking at other structures around the foot biomechanically that could be contributing to the injury. So weak tib anterior, maybe calf being tight. There's things that we can do to help facilitate that. What you could also even do is, what we're able to do is buddy tape, where you can actually tape the big toe to the second toe. That will alleviate some pressure as well. But the biggest thing is actually trying to make sure that scar tissue isn't consistently developing in that toe. As you get more scar tissue due to the injury reoccurring, the injury can get more severe and it become more chronic and more debilitating for the athlete or the patient at hand.
How long is recovery typically?
So depending on severity, if you're into grade 1, it could be anywhere from like 2 to 3 weeks. You get into grade 2, you're looking at anywhere from 2 to 14 days, into 3 weeks, into third grade 3 where there's actually significant tear. You're looking at surgery, so there's a little bit longer recovery with that. Now the goal is to understand the warning signs and actually start understanding, hey, there's a problem here. What's going on? So diagnosis is important. Time is of the essence, because the longer you go, the more pressure you're putting on that foot, the more the injury can get more severe. Like I said, you are seeing a little bit of a drop in these injuries now with the new turf we have. We're not on AstroTurf as much anymore. We're on this field turf, a little bit softer. But you will see it even in basketball players because of the hardwood floor, the constant repetitive nature.
Okay. My next question for you is, do you have any other tips for athletes who might feel pain coming on?
Yeah, so I think the biggest thing, most athletes, even myself, and I'm sure if you did sports, the biggest thing, we're always used to having some sort of pain, right? So the biggest issue that I see with a lot of athletes is they know there's something wrong, and they kind of just ignore to hope, hey, maybe it's going to go away on its own.
Yeah.
Now, typically with an injury like this, you don't realize how much you use your foot until you start actually moving around on it and trying to play. So what you'll see is, what I typically tell patients, if you're having issues with significant gait, modification due to your pain, there's something severe going on. Now, what can happen is if you're having that issue and you're not addressing it, things will start creeping up to the next joint. So now you're putting your ankle at risk, you're putting your knee at risk, and you're putting your back at risk. So most patients with turf toe, it's pretty easy to tell that they have something severe going on because they're limping. It's hard to run. It's extremely painful. You can only tolerate that for so long. So I always tell patients, if you're having issues in that foot, you're icing, you're doing some of the stretching into the foot, into the calf, you're not getting alleviation of symptoms, you know that there's something probably still worse going on there. That's where you want to start getting professional, opinions on that. That's where we come into play with diagnosing, giving you a good lay of the land of what is going on, how can we try to treat this conservatively so we don't end up into a grade 2 or a grade 3 where now you have to rest, you have to immobilize, or you're looking at more of a surgical procedure.
Of course, trying to avoid that.
Absolutely, absolutely. And the biggest thing is you want to get your athletes back on the field safely and as quickly as they can.
Yeah.
You'll see athletes sometimes don't want to tell you everything that's going on because they don't want to be taken off the field. These types of injuries in the lower extremity can be detrimental, to joints above and below, but specifically to the knee.
Yeah. All right. Well, anything else that you want to share?
No, I would say if anyone is experiencing any type of, foot, toe pain, even if you're unsure if it's plantar fasciitis, anything like that, there's a lot that we can do at this office. We treat extremities extremely well. We have some new technology here that's really coming out with soft tissue injuries. We now have laser and shockwave, which has been very, very, very helpful in a lot of these tendinopathies, overuse type of injuries. So if you're having any concerns with foot injuries, foot pain, feel free, please give us a call. Let us evaluate you, see if we can tell you what's going on and two, what the treatment plan would be to get you back on, to the court, onto the field, or just return to normal life activities.
Thank you so much, Dr. Dave, for being here today. I appreciate it.
No problem. Thank you.
Good day and good health.